Hi, Dr. Russ here. Today we got to work with a new patient. Her name is Sefana. She had a couple of injuries to her neck, a couple of whiplashes, and a hyperflexion injury, which has left her with a lot of tension through the left side of her neck and shoulder, coming down from the occiput to the front of the shoulder and the back of the shoulder. She also had an old fracture to her left ankle, the fibula. It was an inversion sprain that caused a spiral fracture on her fibula. That was kind of the beginning of all of her left-sided problems. So we got to work with her today on her whole left side, and we did a video. I hope you enjoy it. Don't forget to subscribe. Thanks for watching. So we've got her left calf and ankle here, and just looking at it, it looks quite normal. There's no muscle atrophy. The skin looks normal. It's not swollen, there's no edema. I like to just kind of always start with some gentle skin level touch, get a sense of skin tone, feel if there is any edema, swelling, congestion, stagnation, and just kind of taking a general survey. And yes, not surprisingly, we're coming into a bunchiness here. This is the lateral gastrocnemius muscle here, and the soleus, and then along the fibula is the tibialis posterior. So these are really crucial muscles to the whole lower body. Let's see how her leg responds to just a little gentle traction as I lift here. Sefana, I'm going to lift your knee, okay? And we're just going to give your leg a little bit of a pull. Good. Okay. So really it feels like the tension in the leg is very much focused here in the ankle. As the way it responds to a little traction is the hip and the knee don't really seem to have any trouble moving through neutral. So her calcaneus here, her heel bone, is stuck in a little bit of an inverted position, which was the direction of the initial trauma. And when I bring it to a neutral position, there's a lot of resistance out here and the lateral ligaments. So I know I want to create some space here. And as I feel her plantar fascia, it's nice and pliable. And as we look at her toes, can we get a nice view of her toes? They're nice and straight. They're not crooked or hammered. I don't see any unusual callus formation. So I think in terms of just general function, the forefoot is pretty good. It's more about midfoot and hindfoot. That's the navicular and the cuneiforms, the talus and calcaneus, kind of in an inverted position. And then we want to see about the fibular movement. That fibula, here's the inferior end of it, and the superior end way up here. And I want to feel like it is able to move superiorly as I evert and dorsiflex her foot, because that's where a lot of crowding in the lateral ankle comes from, is the fibula being a little bit stuck. So as we work here and as we work here, we're going to look for easier neutral position of her hind foot and better inferior to superior movement of her fibula as I dorsiflex and evert her foot. So let's just start now. You ready? Mm-hmm. Okay, good. So I'm bringing her foot, especially her hind foot, into dorsiflexion eversion and inducing some of that movement through the fibula with my other hand as I do, and feeling where is it really stuck. So there's a good spot right there where we want to get some movement. Good, we felt it let go a little bit right there. I'm going to check in with you about my pressure.
It's great.
Good, not too much, good. Give a little bit of traction. And work another couple of degrees of eversion, dorsiflexion in there. It's already moving better. And now I'm really focusing right here. So the fibular calcaneal ligaments, the peroneal tendons are right here between my hand. And let's get a little bit of movement there.
My area is tender.
Mm-hmm. Yep, so she's giving feedback that there's some tenderness right there. Good. Good. Good.
Oh, yeah, that hurts.
Okay. So let's give that a little break. And already I can see her Now she's in neutral here, and there's no resistance to it at all. So that was a good little piece of work we just did. And we're going to bring that up here along the posterior edge of that fibula, where all those deep toe flexors, deep to the Achilles tendon. You can see the Achilles tendon here, and I'm deep to it. I'm working through just however much of those toe flexors I can access. I don't want to be too aggressive. This is our first session after all. And good. So with my fingertip, I'm doing a little bit of neuromuscular work here. And then here as my palm is kind of following to pull on the fascia and give that fascia a little bit of a superior stretch. So I'm kind of trying to do two things at once, and always maintaining that good neutral position of her hind foot so that we're really trying to restore good ankle position and function in the whole calf. So it's not enough to make sure that the ankle works. We want to know that the calf is happy with the ankle working. Otherwise, the ankle will just get stuck again as soon as she walks back to her car. So we have nice, actually, a little bit better movement and smoother sensation here. We're going to lift it a little bit here and go through some dorsiflexion range of motion. And again, I always want to try and project my sensation and palpation into the tissues and feel where are they stuck. So right here is a really good spot. Sefana, can you push the ball of your foot into my hand? Yep, and you can see her gastrocnemius pop up right there, and then relax. So I've got the gastroc here, and then deep to that is the soleus, and you see a lot of adhesion right there, and a lot of focus. It's pretty important that those muscles can function independently. They are close cousins, but they do need to have a little bit of space. So just now there's a lot more dorsiflexion in her ankle, and that feels pretty good. One more time, I'm just going to lift your knee. Good. Okay. Good start. And flush out a little bit more. Make sure any tissues that were broken down get put into the circulation. And if you're ready, we'll transition to have you laying on your right side, okay?
Okay.
Okay. I really like side-lying work, for one thing. It's pretty comfortable for the patients usually because they can breathe without the pressure of the face cradle on their face. Use enough pillows, they feel nice and supported. And most of all, I've got access to everything from the trochanter all the way up to the occiput while, keeping the patient draped and comfortable. And most of the time, I'm going to prop that top knee on a pillow, which we have here today as well. So finding the iliac crest here is really important because it's such a great insertion point for the internal, external oblique, thoracolumbar fascia, and especially the quadratus lumborum. So as I'm coming backward from anterior to posterior, you can see right here where her quadratus lumborum really sets, and this tight. So it's a really good place to start. And I don't want to get in there with my elbow. Thumb pressure is usually enough. Just trying to slide off of the iliac crest down into the muscle, to this tender area where it inserts onto the transverse process of the lumbar vertebrae, and give it a little bit of a stretch, just like that. I don't feel any trigger points here. It's just kind of tight. Right here we've got her 12th rib, which is actually pretty tiny. It ends right there. It's just a few inches on her. That's a really key attachment point for that quadratus lumborum. So you can see with my left hand, I'm giving a little bit of a posterior induction to the ilium, and then with my right hand, I'm just feeling how does that quadratus lumborum respond to that. And now we have good, nice, good movement. So a couple of deep breaths. We can come here to the side of the ribs where the abdominal obliques attach. So again, with the ribs, I really want my fingers to be flat. I don't want to dig in and be pokey because it's sensitive there. Another deep breath. Good. Beautiful. And as the rib cage comes down here, it kind of presents a little bit of an eminence on people right about here around rib 10, as the 11th and 12th ribs are much smaller. And I want to make a little cup with my hand and invite the patient to breathe right in here. I'm going to give a little downward pressure so that her diaphragm has something to work against, so we can really kind of get some good diaphragmatic engagement. And then on the exhalation, it's a gentle pressure down toward the table. I'm not pushing hard. I don't need to push out all her air. I certainly don't want to injure any of her ribs, but it just gives me a sense of that elasticity of her rib cage, which is quite good. And now with my right hand, I'm assessing how these ribs are going to articulate with the spine. I can feel that paraspinal gutter right here. So those ribs come around, dive in front of the vertebra, right there. Everything feels really quite good. So just kind of a gentle myofascial stretch and release. Keep the patient covered and coming up. Good. So here with my thumb, I'm catching on to the inferior angle of her scapula right here. So it comes down, here's the triangle, turns the corner right there. And this is a problem area. Yeah. Yep. And so, yeah, it's tender here, so I'm going to be careful. I'm going to remember the serratus anterior hugging the ribs. And what I've got in between my fingers right here is the latissimus dorsi. And we've got to remember the long thoracic nerve is going to be running in this area. So there's a lot going on. We don't want to be aggressive, but we do want to try and open this up. So beautiful. Good breath. Really nice. So let's get a front view. So now I'm going to use her arm as a lever. Here's the lateral border of her scapula, and I'm kind of retracting her scapula with her arm. And as I'm doing that, I'm going to work against that movement on her serratus anterior. So get some separation here between the serratus and the lat. And it's already inducing nice movement. Deep breath again. Good. So let's change here. And we're here now, just latissimus. Here's where the latissimus and the triceps meet. And she was talking about a lot of tension through the armpit. And I feel like that's probably where it's coming from. So we're going to spend some time creating movement between the humerus here and the scapula here. That's the joint right there. It's the underside of the ball and socket, right? So that ball and socket is all about movement, circumduction. So we're rotating, abducting, flexing, extending, just really trying to stir the ball in that socket and see where is the resistance, where's the ease, and how, beautiful job, good breathing, and how can we get more ease and more movement. And I think we just were able to induce a little bit of more movement there. Good. A deep breath. Good. So let's follow that line here down the triceps. A lot of people holding a lot of tension in the back of their arms. It's an area that doesn't get worked enough. Thank you. Nice. Does it feel safe on your shoulder? Does that feel safe on your shoulder?
Yeah.
Yep, good. I asked because I'm giving her shoulder some traction. And for some folks that can feel, they can have a lot of apprehension about that. And I don't want her to be tensing up. So, nice. Good. can move your hand, this one. So we're going to look at the clavicle here and the pectoralis region. So we can see her clavicle here, pectoral muscle there. Here's the deltoid, the trapezius. Very important scalene triangle right here where we never want to dig. So it's really important to understand your landmarks in this area. And take a deep breath. So I like to feel for differential movement between the clavicle and the first rib, which feels quite good. And on the anterior shoulder, I'm always interested in the coracoid process and its mobility. It's right there. And we got ligaments coming up to the clavicle, which on her feel pretty soft and flexible. And we've got ligaments and muscle connecting it to the humerus, which on her, here's a little bit of congestion right there. So just a little gentle move here. Good. Feels like that pressure feels okay. Mm-hmm. Good. There we go. And a deep breath. Nice. So it really seems to me like on your shoulder, that stuff in the axilla was probably primary. So I think we're ready to move on to the trapezius. And let's tackle that with you face down, okay? Okay. Okay, I like working the trapezius face down. Gives me the opportunity to feel the whole thing. And I was expecting to feel a little bit more bunchiness there than I'm feeling. We've got the upper trap here. Here it is, a little bit more in the middle trap. And rhomboid. I'm going to lower the table a little bit, okay? And pick up your arm, and we're just going to rest the elbow right on my knee, just like that. Okay, in this position, it's easy for me to give her arm a little bit of traction and get a little bit of stretch through, really all the way to the spine. So I am pulling a little bit with my knee. I'm really more pulling with my hands. That's it. Good. So kind of zeroing in on the big bunchy knot right there. That's the middle trapezius between my fingers here. And yeah, I think that's causing you a lot of tension. So we're going to work our way through a little at a time. We don't have to clear this out in one movement or even in one session. Good. It's a good breath. Good.
Feels good. It doesn't hurt.
Good. Thanks. And as I'm here, and I'm getting a little bit more movement and softness through her middle trap, I can feel some stuckness in the rhomboid as well, deep to it. I'm just going to make a mental note of that. Good. Good. Really good. So a little deeper now on this next pass. So you could see before I was kind of grabbing the middle trapezius and stretching it and flushing it. So now I'm going to be deep to that. I'm going to be on the rhomboid and more of the intrinsic spinal muscle. So more fingertip pressure, pushing the middle trap out of the way and getting deep on the rhomboid. And right here we have a trigger point right there. Pretty stuck, I gotta say. So again, we don't want to be aggressive. We just kind of want to be direct. Good. As I give a little traction to her arm and pull on her scapula a little bit, that way it helps to, there, it just gave a nice little twitch and a little movement. And we're doing good. Good. Okay, let's get you turned over so we can work on your neck. So coming to what I think will be the last part of this session is the neck. And here it's really easy to work both sides at the same time. So again, here's my thumb in her scalene triangle, not digging. I'm not pressing hard. And what I want to do is get a sense, like I did with her ankle, how does it respond to a neutral position? And neutral position for the neck is obviously squared over the shoulders with a little bit of a lordosis. And I know you can't see this, but I can feel quite a bit of resistance to that right around here. I'd say C3 and C4. So here on her left side, there's her SCM muscle, and that is doing okay, but just posterior to it, I would say that's the levator scapula. You can see that knot right there, a little bit of a twitch under there. So let's see about kind of opening up a little space here on her left side before we necessarily jump right into an adjustment. Let's see what happens if we can kind of just gently, suggest a neutral position for this third cervical. And it's open to the suggestion, I would say. So with my thumb here, my left thumb, I am anchoring the bottom of the levator scapula. I've got it on the top of the scapula, and then with my right hand, I'm giving small stretches and little movements with traction to her neck, really kind of grabbing onto the top of the levator scapula right there. And you're doing great. A deep breath. Good. And now that we got that opened up a little bit, now the upper trapezius is starting to show some of its stuff right there. A couple of deep breaths for me here. I can tell that Sefana is a seasoned recipient of body work because her breathing is great. She knows how to let go, and is a massage therapist as well. So this makes my job a little easier because her body just kind of needs a little suggestion, and then it runs with it. And these are things you learn about your patients usually in the first couple of sessions, is how much directness and how much just induction and suggestion do their bodies need. Okay, so I think there is an adjustment in your future right here. I should say your near future. But first, let's loosen up your right side. Okay. Mm-hmm. Feeling through SCM, levator. Yeah, and here on this side, it's the SCM is a little more involved. Okay, and again, easy, gentle opening, stretching. Deep breath for me, please. Yeah, and as her SCM comes, here's her mastoid process right there, and getting a nice little bit of a stretch right at the very top of that SCM. Good. And we don't want to pretend that the muscle stops right there. When it meets the bone, it definitely envelops the bone. So don't forget to work the temporal bone and the mastoid as well. That fascia comes right up over the ear, through the temporalis muscle, and into the jaw. Nice job. Okay. So let's come back and kind of revisit that neutral position of the neck. It's much easier. And what it's showing me now is that the occiput is shifted to the left. So I want to feel that occiput on an atlas movement, and unless I'm mistaken, this is the movement we want to induce right here. Can we adjust this? Mm-hmm. Okay, so you take a couple of deep breaths. Yeah, it's good. I'm going to stand and lean. Good. Easy. Good. Okay, just a gentle stretch on the masseter. Good. Almost done. Nice.